It is Tuesday, February 24th, and the most important state address is not necessarily that of the union, it's that of your heart health. Welcome back to another live Q&A with Dr. Kohif, with Kohif Tailor Health here in Sierra Vista. We're so excited that you are joining us. And again, this is a live Q&A. We have questions already set up, but if you have questions about your heart health, this is the time to address those with Dr. Kohif. First of all, Dr. Kohif, thank you so much for joining us again and letting us stop by and see you.
Always nice to have you.
February is the month of love. It's the month of the heart. And talking about heart health is so important for so many reasons. How can precision medicine, which you practice here at Kohif Tailor Health, how is that preparing people to have a healthier heart?
Absolutely. First of all, thank you for coming again. I mean, it's always nice to have you. And, one thing I would like to share first of all with people is, that heart disease is the leading cause of death worldwide, and especially in the US as well. Still number one, right?
So it's very important.
I mean, yeah. So there are many ways, back to your question, there are many ways that we can help people with heart health, So I would say there are two tracks or ways. The first one is prevention. And we're all about prevention here, right? And then the second is, after the fact, if people already, have heart conditions and then their own medications, whatever, that's, of course, we can help them with that type of reactive type of healthcare. So back to prevention. I mean, when it comes to heart health is very complicated. It's not something that we can call like a monogenic disease or something like, if you have that gene, that means you will have it. No, it's a complex disease. So all heart disease, high blood pressure, cardiovascular disease, all these are complex disease, meaning that the factors leading to those diseases are many. So we have genetics, we have lifestyle, do you exercise or no? You have a sedentary lifestyle and things like that, And then other factors such as medication that might be causing those as well, right? So in place here, when if you want to work with us, we work on the prevention side, which is, again, we prioritize prevention, but most of our patients, again, they come after the fact. So we're definitely going to step in, and we'll discuss shortly how we can help. So,
and that's the important part. Again, focusing on heart health today is our live Q&A topic. If you have questions about heart health or any other sort of questions about precision medicine here at Kohif Tailor Health in Sierra Vista or Southern Arizona, or you're watching somewhere around the world, you need answers about certain things. That's why we are live today. First question we have in the post description, a bunch of questions there, but you can leave your question in the comments section. How can someone find out if they have hidden heart or health risks from home?
Absolutely, yeah. So, and that part from home is important because we just transitioned into a fully remote model. So you can do everything from home, right? So, I mean, with us, with our services, we definitely can help you from home to do all these precision medicine services, especially when it comes to heart health, right? So we can do the assessment, the first free 15-minute consult or assessment online from the comfort of your home, and it's free still, And then if we proceed, if we want to do like genetic test, we do it from home as well. We can ship with the kit, they come in instructions, so easy. And then we give you access to our wonderful system. We have a complete patient portal for patients where you can put all your information, because we need those information. Things like your lifestyle, medical history, medications, age, weight, all these different unique characteristics, right? So you can do this from home, and then when the results are received, you still can meet and follow up, with one of our specialists online. So definitely you can do all of these, from the comfort of your home.
And what makes it a personalized health assessment, and why is a personalized health assessment better than like a standard checkup?
Absolutely, because standard checkups usually ignore things like your genetics, for example. Lifestyle is not prioritized. I mean, also things like drug gene, and drug disease, and drug herb interactions, which cause a lot of problems when it comes to heart health, as we explained shortly. So I mean, all these different factors, of course, make us, I would say, we take into consideration, they make us unique. And usually, or traditional healthcare, usually they ignore or, they don't look at these factors. We believe they are very important when it comes to heart health.
And again, we're talking to Dr. Kohif at Kohif Tailor Health here in Southern Arizona today about heart health. And again, your free 15-minute online consultation is waiting for you at kohifpharmagenics.com. The information is in the post description. So there's so many factors that come into play with heart health, including genetics, nutrition, and medications. How do those things affect the health of our heart?
Absolutely. First of all, we take all these factors into consideration again in our practice. That's what precision medicine is all about, right? But I mean, so let's take it one by one. When it comes to genetics, your genes can tell us a lot when it comes to your heart health. First of all, it can tell us if you have some predisposition that might put you in risk to develop certain heart disease. So it can tell us also about your nutrition, which is the second thing that we talked about. And I think that has a lot to do with a genetic test we perform in places called nutrigenomics. And that tells us how nutrition affects your body and your genes, and how genes impact your diet and your nutrition as well. And not only nutrition, lifestyle, exercise, and many other things, right?
Yeah.
So definitely, so your genetics, your nutrition, lifestyle as well. I mean, lifestyle can impact heart health, in many ways. First of all, if you have a sedentary lifestyle, you don't exercise enough, you're not active, those things we know can relate, and impact your heart health. It can cause, things like high blood pressure, right? High cholesterol, and all these things are related to heart health, of course. So yeah, and we make sure to cover all these for all our patients,
And it's so vast, thinking about the heart is a muscle. At the end of the day, it is the muscle that keeps us going, and there's so much to learn about it, so much to understand about it.
Yeah.
And can someone really take control? By the way, this is a live Q&A. If you have questions about heart health or anything else, just leave them in the comment section as we're live right here, or even after the fact. If you're watching this after the fact, leave questions, and Dr. Kohif will see them here at Kohif Tailor Health. Can someone, we think of, well, in Sierra Vista, it's maybe not, we don't have the right medical providers here in Sierra Vista to do this. We need to travel to do our heart health. And while that may be the case with certain people, can we really take control of health without leaving Sierra Vista, specifically our heart health?
Absolutely, yeah. And even if you live Sierra Vista again, because with the remote and virtual telemedicine model we have now, it doesn't matter really. If you're in Sierra Vista or if you travel to another city, you can still get access to all our services from the comfort of your home. Yeah, so definitely.
But also, again, being able to utilize that just through the website.
Yeah, absolutely. Yeah. So I mean, it's the website is in probably the description of the post, and then it's so simple. You just you go on the website. There is a button there that says book your free 15-minute consult. That's all you need to do. And you click on it, you put your information, and then you can have the free initial 15-minute consult either with me or somebody else on the team.
Which is awesome. And thinking about when someone does that, let's say they click on that and they end up going to kohifpharmagenics.com, which is in the post description. You just tap on that and find the free 15-minute consultation, and you can get that set up with Dr. Kohif and his team today, right online from the comfort of your home. I'm sure you have amazing stories and testimonials of people who have seen an improvement from changing maybe either medications or nutrition or lifestyle. How fast can someone see improvements after starting that personalized program?
This is a really good question. And it all comes down to how severe your case is and your situation. And again, it's all about tailoring health. So this is not a cookie cutter, right? So this is why. So it depends on, we see people who improve in 2-3 days. We have patients, with the hypertension or high blood pressure. And then all they need was just some medication adjustment based on the genetics or lifestyle changes. And we actually see the changes in 2-3 days. Some others, it might take 2 to 3 weeks, I would say, for them, like if they have chronic kidney disease and things like that. But it's, again, it depends on your situation and what conditions you have. And, if you're taking medications, what kind of lifestyle do you have, right? So, that's one thing that we're going to assess and evaluate before you actually proceed with us. So it's all about tailoring the care.
Exactly. And I think many people have been in that situation where once you finally go and see a qualified physician to be able to address the specific need, that whatever the issue is, sometimes you can feel it inside of you when it changes. And you can feel, oh my goodness, I'm feeling better right now.
Yeah. And what's one thing that's cool about us also is our system. One thing I'd like to tell people is, in our system, we do have something that's very unique. So if they have, for example, like high blood pressure, or they have something, diabetes, whatever it is, or asthma, in our system, we have a very unique feature where from the comfort of their home, they can actually go home and enter the values of their blood pressure, glucose, whatever, or oxygen level in the system without having to, people sometimes want to track, the blood pressure on paper. No, we have a very wonderful system that track it.
All electronic.
All electronic, from from their phone or laptop. And then our specialist will be able to see that on their end as well. And, this way we're able to follow up, because we don't just want to deliver care here. What we do is we deliver care, but also monitor responses to make sure that, yes, that's actually working for you. And if not working, then we use our clinical algorithms in place to see, okay, what else do we need to do? So
it's absolutely amazing. And obviously this is almost a question that it needs to be asked, especially for those of us. Look, I'm a guy who's like, I'll wait until it hurts a little bit more. I don't need to go see a doctor today. Why is it important to act now rather than to wait when it comes to heart health?
I mean, I think that's a very important question. And the answer to it will probably need hours to explain, the benefits of preemptive healthcare. But one thing I would say is just think about, I'm actually going to give you an example. I had a patient like 2 weeks ago here, and she came with somebody else. And then she was like, okay, I would like to proceed, but then I need probably some weeks. Give me some weeks and I will be back. Her partner that came with her, he did the test and proceeded. And then, 2 weeks, 10 days later, when they came back, they told us that actually she was in the hospital and she had a TIA.
Oh no!
And now
ischemic attack, which is a mini stroke. Is that what that is?
Yeah. And then she was put on medications, and then she was not reacting good to these medications. And he was like, she told me, I wish I had listened to Dr. Kohif. And it was sad to hear that story, but this simplifies or that explains just one scenario why prevention is more important than reacting after the fact. So with prevention or preemptive type of healthcare, you will know, because those insights are for lifetime. I mean, because your genes, those genes we test, almost they never change. So when you're told you're not going to react good to that food or that medication, it's for lifetime. That's something that's not going to change, right? So I mean, having those insights in place already, help you prevent a lot of conditions and a lot of things that might cost you even a lot of money in the future, from ER and ER visits, hospitalizations, uncovered medication, and many, many, many other things. So
So proactive, preventative care. And that is the most important step you can take today, simply by tapping in the post description, kohifpharmagenics.com. Schedule your free 15-minute consultation right now. Don't wait. As we were focusing on heart health and Heart Month here with Dr. Kohif at Kohif Tailor Health, you just recently, like we talked about earlier, if you're just joining us, you can leave a question in the comments section. We'd love to answer that for you as well, as we have other questions here. You recently switched to all remote instead of in person. What makes the remote precision medicine program work different than traditional clinics?
Yeah, again, so traditional clinics is probably is based on the average patient. Your care is based on the average patient, and it's a one-size-fits-all care, right? But with us, it's never a one-size-fits-all. It's all unique. It's the care that works for you and your unique biology, again. So we take into consideration your genetics, your lifestyle, environmental exposure, medical history, family medical history, all these different, pieces of that big multifactorial puzzle when it comes to human body, because the human body is very complex. So, it's not one-size-fits-all care. And then again, we don't have restrictions in place due to insurance. That's something worth mentioning as well. So no limitations, no restrictions, no delays. I mean, it's very rare that we do have delays in place sometimes for some genetic tests, that when somebody doesn't have enough DNA, but we inform them to come back for that. But it happened once or twice in 5-6 months. But yeah, so it's all about a care that's actually that works for you, And people wonder all the time why medication works for me, but doesn't work for somebody else, or why a medication might cause problems for me and not for somebody else. I mean, this is just one side of it. But again, why some food or diet might actually make me have sensitivity or allergic reaction to certain things. but others don't. So I mean, the answer, it has a lot to do with your genetics, and that's one thing we take into consideration. But again, we also practice precision medicine. We don't want to practice genetic reductionism, meaning genetics is a big factor, but then we look at the whole, holistic picture.
Looking at you as an individual,
As an
that
individual.
is the most important part, down to the genetic level, all the way through this proactive preventative care that Kohif Tailor Health can offer from the comfort of your home here, looking at Heart Health Month. Dr. Kohif, are there some simple steps right now that the viewers can take today to start improving their heart health?
Absolutely. You go to the website, kohifpharmajet.com, and then over there, you just either you will find in the headline, book an appointment, and it's free again. It's always going to be free, for our potential patients or customers. You just go there and you go with it, you click on that link, it will ask you for simple information, your name and email and things like that. And then you can do it virtually, meaning you can join from your phone or from your laptop, whatever, And then it's so
simple. You got the screen there. You got the screen on your phone. Yeah.
That's it. And we have a very secure HIPAA-compliant video platform, where we perform all our telehealth consults, virtual consults. So everything is secure. Your data is secure. It's not shared with anybody else. So yeah.
And that is the way that so many clinics across the world are doing things now, and being able to offer that here in Southern Arizona.
Except that we're the only ones that are precision medicine based.
Exactly. And that's where the difference is, because it is precision based, proactive care here. How does that remote assessment work? So how do people do labs and testing and recommendations?
So to start, when you book the consult and then you meet with us virtually, and then after the consult, when we proceed, if you want to be one of our patients or customers, you receive an email to join our system. And then there, we send you the kits for our genetic test, simple cheek swab. We send it home. It comes on instructions. And if you're struggling or anything, you can always call us and our team will help you. But yeah, it's very straightforward. You do that, and it comes with a prepaid return label that you ship. You go to whatever, USPS or whatever, and you just ship it, and it goes to our lab. And when the results are received, it goes internally and securely into our system, and then you get notified by email, or we can call you as well. And then you come, we schedule you for the follow-up, and everything is virtual. Yeah.
Which is absolutely incredible, again, to think about. And the information is all in the post description at that website right there. It looks like we might have a question coming in, so let's see here. Where is the question? Already posted thoughts. It's interesting talking about what the doctors have to say is what they're talking about, the differences between seeing a physician in-house and then doing it online, and then possibly getting second opinions as well. I mean, that's something that everyone, if there's any serious diagnosis, I think most physicians would say, hey, if you'd like a second opinion, that would be very good to get.
That's a very good point. With us, we have two models, but the main model we have is the precision medicine model, meaning we work with you and your healthcare provider. We do that all the time, And our trained, we have clinical pharmacists trained in genomic medicine, which is very rare, because it's a brand new field. And we do have also DOs and MDs in place in case if needed. But most of them, I would say, our patients, they come to us, use us for the precision layer, and then we communicate the results and the recommendations with them and their provider. And it's so easy. So in this case, we schedule like a phone call or sometimes a telemedicine consult with their provider being on call as well. It's so easy. We review the genetics because, when it comes to genetics, it's very complex, and there is a huge lack of education when it comes to precision medicine and genetics as well. So if you were to take your genetic results and go to your doctor, they're going to be like, what am I doing with this, right? Because they're not trained in this.
Right.
But that's our job. So we do this comprehensive analysis of your genetics, lifestyle, and everything, and we provide very detailed recommendations to you and your healthcare provider. And also, because we have a very wonderful system, you can actually access this recommendation system as well.
And again, being able to work with people, if you already have a primary care physician, but you would still like to utilize the precision care that comes with Kohif Pharmagenics right at the website.
We do that all the time, actually. We do that all the time. We have primary care providers and specialists, from Benson, Sierra Vista, Bisbee, different, towns and cities. And then they just, refer patients to us sometimes as well. And then we help them and, the patients and their providers as well to navigate, precision medicine data. Yeah, so.
It's all about heart health here today with Dr. Kohif.
And also you see
Kohif Tailor. Exactly. You got the red. You got your Jordan shirt right there. I forgot. I should have worn red myself, and we could have been twinsies. But instead, we are just about ready to wrap up. Again, if you have questions about how Tailor Health can help you, whether it comes to your heart health, pulmonary, to any sort of ailment or chronic disease that you are dealing with, or maybe someone in your family is dealing with, precision proactive care is a great tool to be able to use. And before we get to our last question, Dr. Kohif, I know people always have that question about insurance and how that works here, or doesn't need to work here.
We talked about this before, but to be honest, I want, we have full transparent protocols in place with our patients. As Kohif Pharmagenics or Kohif Tailor Health, division of Kohif Pharmagenics, we have two missions really. The first is a change in the clinical model from a one-size-fits-all care into a unique model that works for you individually. And the other is no more insurance-based. So I want people to understand that it's not that we can't work with insurance. We can. It's actually financially more enticing for us to work with insurance, but we're sacrificing that part, the financial model, okay, because we know what insurance has in place. Insurance put restrictions on how much time you spend with your provider, what kind of care you receive, services covered and things like that. And when it comes to genetic tests, they're not covered anyway. I mean, some are covered, but at the level we deliver, they're not going to be covered. So we have many examples and companies shut down for the same reason.
Right.
And we don't want to go there, right? And this is why we wanted to be innovative when it comes to insurance. So we don't work with insurance for these, obvious reasons. But at the same time, we have protocols in place for people and financial models. We help our patients. And I wouldn't say, based on 4 or 5 months being here in Sierra Vista, I don't think it was actually many challenge for us financially, because again, we work with people all the time, and we have tiers and plans in place, and we have the cheapest genetic test. If talking about genetic tests, we have the cheap genetic test. Especially when it comes to the coverage to cover.
And still think even the least expensive genetic test will still provide so much information for the patient.
Yeah, and again, genetic test, but then we combine with everything else, because not just genetics, and then you have the interpretation, and then you have the comprehensive analysis of your entire clinical data, your lifestyle, your environment exposure, medical history, and so on, right? So I don't want people to feel like we're not attacking insurance, but again, it's a big challenge, one of the biggest challenges in healthcare. Okay, so if we go down that route, then we probably would become just like any practice, with no respect to them. But we want to practice freely, and this is why we don't work with insurance. And people, we appreciate that people understand this, and we're sacrificing financially. Honestly, we are. So So I hope that I just wanted to explain this part.
And it's always worthy of explanation, because people in America, we always think of, okay, do they take my insurance? Is insurance, part of the program here? And knowing that these tests for the genetic side of things are so affordable that insurance, number one, is not needed, and technically you're losing out. The patient is gaining, because there is no insurance middleman working between the healthcare provider, the precision healthcare provider, and the patient itself. Well, as we get wrapped up here today on this Heart Health edition of talking to Dr. Kohif here at Kohif Tailor Health, KohifPharmagenics.com. All the information is in the post description. Dr. Kohif, last question, how do listeners schedule that personalized remote program easily?
Again, so in the post description, you just click on that link to our website. You just Google Kohif Tailor Health, just like the name of the company, and then that's it. And then you go there on the website, you will have that button that says book an appointment. You go there, put your information, your name, email, and this is it. And then you'll receive an automatic email with the link, with the time of your appointment, and then with the link to join. And usually you'll get a reminder as well, like 1 day before the appointment, and also 1 hour before your appointment as well. So this way, it's
great reminders.
Great reminders, yeah.
And that is just one tap away of your finger on your phone or your device that you're watching us on right now. It is KohifPharmagenics.com. The link is in the post description. Book your free 15-minute consultation today with Dr. Kohif and the amazing team here at Kohif Pharmagenics. Dr. Kohif, thank you so much for taking the time to talk to us about heart health today. If you're just joining us, be kind, rewind, check out all of the questions. Very intricate questions about how we can be healthier and choose to be healthier to try to get our hearts as healthy as possible. You know, we got these tickers here and we got to make sure that the ticker still works and stays as long as we are around, and making sure that we're as healthy as we can be for our family, for our friends, for our coworkers, and everybody else who relies on us. This is why heart health is so important.
Absolutely. And then again, let's remember that it's still the leading cause of death.
Yes.
And then we're very proactive when it comes to heart health, because this is one of our missions. Again, not just heart health, but since we're talking about heart health as the first leading cause of death, I mean, that's huge. And this is why our goal is to help people to take the, measurements in place to be able to, prevent heart condition, heart disease before the facts. We don't want to see people after the facts, as just one of the examples I explained, a while ago. But then we want people to be practice type of preventative, preemptive healthcare. So this way you avoid many heart health and heart health related conditions like diabetes, high blood pressure, high cholesterol, and things like that. Yeah.
And it can all start with a simple genetic test, just from a simple free 15-minute consultation with Dr. Kohif and his team at KohifPharmagenics.com. Check the post description for all the details. And if you are watching this after the fact, after we've already gone off the live airwaves here on Cool FM Live, make sure if you have a question, leave it in the comments section. And we know that Dr. Kohif and his team will be monitoring that for the next few days. So make sure that you get that free consultation. And again, as Dr. Kohif said, maybe you have a primary care physician here in Southern Arizona. That's fantastic. You can take that primary care and make it precision simply by getting that genetic test or involving Kohif Tailor Health into your primary care routine. Dr. Kohif, thank you so much. Always great to see you. Always enjoy this time. And thank you for watching. Maybe you know someone who is in need of primary precision care for their health. Please tag them in this video. Share this video around. Let people know. We got this heart. We need to make it last. Heart Health Month is here, and you can keep your heart healthy simply by tapping that KohifPharmagenics.com website in the post description and booking your free 15-minute consultation. Thank you so much for watching. Thank you so much for sharing. Have a great day, everybody. We'll check in with you again later on. Dr. Kohif, thank you. Thank you so much.